Hello everyone, OT Life Hacker here. What's up? Happy Friday! Woohoo! Check out the view. Woohoo! I know, I love it too. You are not only checking out the view, but you are going to be going on this walk with me. That's right, you're stuck with me. So no fast forwarding in this video so you can enjoy the view too. Just kidding. But yeah, so today's topic, what I want to walk and talk with you guys about, hint, hint, hey, hey, is dealing with difficult encounters, difficult interactions that you may have with people. And it doesn't have to be just in the work field, it can be anywhere. So, because we are always in some form having to interact with others or be involved with other people. And so that's honestly one of the things I personally love is the dynamic interactions you have and how it requires a lot of problem solving and being present and open to the different perspectives and experiences, knowledge that people have. And it's just, I find it very humbling. But there's definitely some challenges that can arise along the way that I'd love to share with you guys on how I mentally help myself through it. And so this is going to be sort of a strategies for working with difficult situations that involve people who are a bit challenging, as well as how to internally cope with it all so that you don't drain your energy or even take on some negativity from the experience you had with a person or people. All right, so a quick little story on the person is that they had experienced a fall, had sustained some major injuries, and they are adamant about having therapy, but at the same time they are struggling to receive therapy because of cultural reasons and because of the major thing is because of fear of falling for them. And the thing is that their fear of falling masks itself as frustration and defensiveness towards others. So what I mean is that we see that they have a fear of falling, and they also have cognitive they have some issues with their thinking and information processing and all of that. But it's hard to tell at first because they are actually they come across as very combative and argumentative. So when you are asking them if they would like therapy, they often will refuse it. So they refuse a lot of treatments. The doctors have ordered a few different tests for them and therapy and other treatments, but they have refused majority of that. And yet they do still want to stay in the hospital because they want to get better. But there's a lot of things at play here, and the strategy that can help you, again, for yourself as well as for the patient, the actual interaction, is definitely being present in the moment, meaning you are actually keeping an open mind on what they are saying and trying to see how you can navigate the situation with them. What is really the core problems. And in this story that I shared with you, I recognize that the core problems, through discussion with the other healthcare team, the core problems actually laid in their cognition and their fear of falling. So all of the anger and refusal, and through being very having a lot of excuses for why they don't want to do something, that was very likely due to the fact that they are struggling with the challenges of their own cognition, their own thinking not working as well as it did. Just think, guys, imagine putting yourself in that person's shoes. You have you had fallen unconscious after a fall, you woke up, and the next thing you know, you're in a hospital. You used to be completely independent, did everything on your own, hung out with your friends, watched TV, watched whatever you wanted, made whatever food you wanted, gone out to the grocery store, chose all your own vegetables, all of that. And then now you are in a place where you can't do anything that you are used to doing. You get up in the morning and you stay in a bed. You wake up in the morning and you stay in a bed, and you have a TV, you have food. Now, I'm not trying to paint a dreary situation. It is really what you make of it. So in the hospital, you could be someone who is very active and goes for walks around the hospital, if you're able to, of course. And you can chat with your friends on the phone, on the computer, or what have you. So it's really what you make of it. But this person, again, they had gone through all these transitions, and they had realized that they had fallen, and it's such a scary thing for them. The fact that they fell and ended up in the situation they are in is a really scary thing. There's no one they know. There's people coming in constantly, changing in and out. People are talking about them with terms that they don't know, or talking to them using terms they may not know. And this all happened over just the fact that they close their eyes, open their eyes, and to them it's just they open their eyes to wake up to a whole new life, which is, that's what they may likely think it to be. And so it's really, really scary to go through so many different transitions, and you're essentially grieving over the loss of the previous roles you had. Again, maybe you were a grandparent who would play with your grandkids, and now you can't do that. Now you can't even see them in this current time. So it's really, really challenging. And many times people may come across in not the most pleasant ways, or confused, or not as receptive as you would like them to be, many times because of the psychosocial issues, many times because they are adjusting, they're coping with all of this scariness, all of these changes that have happened so quickly. The fact that even if, say, you end up wearing, your shoes break, that's a scary thing in itself, isn't it? That you lose your favorite shoes and have to wear new shoes. I don't know. That's just one story example. But I'm saying that empathy is a big thing. Recognizing where this person may be at, and there's so many other things at play, and also the fact that, like I said, the thinking, maybe she's noticed that she's become a little more forgetful, or that she doesn't feel that she can do things as well as before. So she may have a mix of depression and finding herself thinking, why am I forgetting things? Is it because I'm getting older, or is there something wrong with me? So a lot of different things that can scare people and cause them to behave in a certain way. So whenever someone behaves in a certain way or responds to you in a certain way that you don't find very pleasant, again, I say you don't take it out on yourself, but I mean more so, please don't take it out on yourself, because just be present, be there with an open mind and open heart to take in what is happening, what is being said, and also know that it may be that there's some psychosocial or psychological or mental health stuff going on for this person, or cognitive things happening. So the best way that you can help someone isn't to take it to heart that they call you like a really bad such and such or call you names. It's to recognize, how can I help you? What's the best way to help? Sometimes the best way to help may be to